5 early signs of lung cancer you need to know. 1. Recognize early signs of lung cancer. Lung cancer symptoms are often non-specific and not very obvious. And most people only discover the disease when it is in its late stages. Therefore, people at high risk of lung cancer, such as smokers, those exposed to cigarette smoke, or those over 50 years old, should have a low-dose CT scan of the lungs to screen for lung cancer. Stage advanced lung cancer often have noticeable symptoms such as backache and headaches, weight loss, and fatigue. Bone pain is also common, as lung cancer tends to spread to the bones. Although most of the people who are diagnosed with lung cancer, there are no obvious symptoms in the early stages. But some people can recognize them themselves. However, remember that these symptoms can also be caused by other diseases, not just lung cancer. Below are 5 signs of lung cancer that everyone needs to know for timely examination and treatment. Prolonged cough. A persistent cough is often the earliest sign of lung cancer. However, cough is a non-specific symptom. Cold and flu. It also commonly causes some people to cough for a few weeks. No matter how sensitive the patient's lungs are, if the runny nose and other symptoms have disappeared and the patient still persistent cough, then it is an abnormal sign. In the case of viral illness, the patient does not need to worry too much about the risk of lung cancer. If a patient has a cough that lasts for 2 to 3 weeks even though it is not related to any virus or bacteria, the patient should see a doctor immediately. Shortness of breath. According to the American Cancer Society, shortness of breath is considered a sign of lung cancer that needs to be noted. Although this symptom usually appears in the late stages, the feeling of shortness of breath can also occur when there is a tumor in the body that blocks the respiratory tract. Therefore, if people have difficulty breathing for no apparent reason, they need to see a doctor. 3. Coughing up blood. Some patients may coughing up blood if the tumor is located near the bronchus. If you cough up blood or see a small amount of reddish-brown sputum for no apparent reason, you should contact your doctor as soon as possible. In addition, people with coughing up blood are accompanied by dizzy or difficulty breathing should see a doctor immediately. 4. Chest pain. Lung cancer causes pain in patients due to many different reasons: large tumor compression, lung cancer metastasis to the bone, or fluid accumulation in the pleura. Chest pain. Lung cancer often becomes worse when the patient coughs, laughs, or breathes deeply. Because chest pain can be a sign of many other serious conditions, patients should notify their doctor if they experience chest discomfort of unknown cause. Any persistent or severe chest pain should be thoroughly investigated. 5 other signs of lung cancer. Other signs of lung cancer include: patients with lung cancer may experience unexplained weight loss, general deterioration in health, and fatigue. Lung cancer can affect the vocal cords, leading to changes in voice and a dry cough. Some patients experience changes in saliva color, often blood-tinged. 2. Causes of lung cancer. Being aware of the causes and risk factors for lung cancer not only helps us realize the importance of prevention but also proactively reduces exposure to potential factors. Exposure to tobacco smoke, smoking, both active and passive, damages lung tissue and causes genetic changes in lung cells. Other alternative products also increase the risk of lung cancer. Polluted work and living environments. Pollutants such as vehicle exhaust, fine dust, and industrial chemicals increase the risk of lung cancer by damaging lung tissue. Genetics and family history. If a person has had lung cancer, their blood relatives are more likely to develop the disease. Genetic variations can affect the growth and function of lung cells. Exposure to toxic substances, radon, asbestos, and industrial chemicals, such as asbestos, welding fumes, and nickel, can cause lung cancer. Exposure to polluted air pollutants in industrial areas, such as fine dust, exhaust fumes and chemicals, can damage the lungs and increase the risk of lung cancer. 3. Methods for diagnosing early-stage lung cancer. To detect lung cancer at an early stage, your doctor may use the following diagnostic methods. Clinical examination. The doctor will perform a physical examination, assess respiratory function and collect information about medical history to detect early signs of lung cancer. Imaging tests. Low-dose CT scan of the lungs or more advanced diagnostic tests may include chest X-ray, ultrasound, computed tomography, CT, PET-CT, and magnetic resonance imaging, MRI. Certain blood tests, tumor biomarkers, liver function tests, kidney function tests, and respiratory function tests may also be done. Cytology test includes testing of mucus and bronchial fluid to detect the presence of cancer cells. Prognostic diagnostic tests include determining the type of cancer cells and the extent of cancer metastasis in the body. 4. Treatment. There is a significant difference in survival rates between early detection and late detection of lung cancer. In fact, the 5-year survival rate for people with late-stage lung cancer is less than 10%. But if lung cancer is detected at its earliest stage, patients have a better chance of being treated successfully. Early-stage lung cancer can be effectively treated. Before deciding on a treatment method, the doctor will consider the extent of metastasis, the location and size of the tumor, and the patient's general health. Treatment methods include surgery, endoscopic or open surgery to remove the tumor in the lung and surrounding tissues. Chemotherapy. Chemotherapy drugs can be used before or after surgery to destroy potential cancer cells or reduce the size of the tumor before surgery. Today, with the advancement of science, immunotherapy or targeted therapy can be applied to treat and help prolong life and reduce the risk of recurrence for patients. Radiotherapy uses radiation to kill cancer cells. This method can be applied alone or combined with surgery and chemotherapy to increase the effectiveness of treatment and disease control. Symptomatic treatment. Treatment is primarily aimed at relieving symptoms such as pain, shortness of breath, and fatigue through pharmacological support, nutritional counseling, and other supportive care methods. When you detect signs of early-stage lung cancer, you can go to Vinmec International General Hospital for examination and treatment. Vinmec provides a full range of necessary medical care services for cancer patients, including chemotherapy, radiotherapy, surgical treatment, medical treatment, etc. At the same time, Vinmec supports pain control through physical therapy, peripheral nerve blocks, sympathetic blocks and other methods.